Hi, everyone. Dr. Erin Stubblefield here with today's session of the KMC University Help Desk. Today, let's talk about probably one of the most important portions of your practice, the report of findings, or the ROF. As offices look to revamp policies and procedures, this simple yet overlooked piece is really critical. You might not realize how important it is until you see the impact that it has on your clinic, both the negative impact when you skip it and the massive positive impact when you start doing it right. This episode is something you'll want to listen to as we cover the four parts to an effective ROF. The first is feeding the hunger for information. Well, what are we talking about here? It's when the patient comes in, right? They have an issue and they are hungry for answers. We live in a society that is always seeking information. They want to know what's wrong with me? Why is this happening? And what's it going to take to get better? More importantly, stay better. Well, you're the doctor. They want to hear your professional opinion. The ROF is your chance to give them that structure and confidence. Number two is laying out the care plan. So, what does this conversation look like? You need to clearly communicate three things. The issue, this is what you have going on based on your exam. The goal, this is why I believe we can accomplish your goals. And the plan, we're going to accomplish this by this date or this time frame. Now we're going to review your progress with a re-exam. Number three, planting the maintenance seed early. A huge part of this is introducing the idea of maintenance care before their episode of acute care is actually over. A lot of patients will bow out when they think their insurance isn't going to pay. But if we start planting those seeds of wellness and supportive care along the way, it changes that conversation. So start letting them know that the end of corrective care is graduation, and it's a good thing. Explain that your goal is to help them stay well adjusted so they can keep doing what they love. Discuss that their insurance may bow out at a certain point and that they will have a financial responsibility after that for their long-term health. But don't surprise them with this at the end. That's always a recipe for a frustrated patient. And lastly, it's that financial handoff. Once you, the doctor, deliver that critical and clinical report of findings, you hand that baton over to your team member for the financial commitment conversation. Patients are cautious with their money. They want to know what the investment is in their health, what the investment is in your practice, and they want to know that their money is being spent appropriately. So your front office needs to be clear. This is your insurance. This is what we expect your insurance to cover based on these limitations. This is a covered service. And then this is what's going to be considered supportive care. So clear communication and financial options up front is going to ensure that there's no big surprises along the way. I'll bet you that the clarity on your ROF will really help your patient retention, increase your patient referrals, and keep patients with your office for the long haul in supportive care. But if you find yourself struggling with how to structure your report of findings, you know where to reach out. The KMC University Library is a wealth of information to shore up this piece of your practice. And if you want even more, our one-to-one coaching can do so much to help your practice. So like, share, and follow KMC University on all of our social media platforms for more practice tips and tricks from the chiropractic, reimbursement, and compliance experts.